My name's Audrey Eno, and my presentation is on the Roseolovirus, and this is my audience. Okay, well, the Roseolovirus is a relatively common infection that is caused by a virus. It appears most frequently in infants and young children. It usually is discovered by manifestations of extremely high fevers that can cause seizures and a rash that appears a few days after the fever. When examining the Roseolovirus, it is important to consider the pathophysiology of the virus, the management of the virus, the pharmacological agents, and the prevention plan. So Roseolovirus is classified as a human herpes virus, and as a human herpes virus, it has large and double-stranded with linear genomes. The capsid forms in icosahedral shape, circular, like a soccer ball. And it has an envelope composed of the host cell's plasma membranes, and it surrounds the capsid. When considering the virulence of Roseolovirus, it's not too severe. It is mostly harmful because of the high fever, which in small children can cause seizures. It's rare for secondary issues to result from the Roseolovirus, but an example of more serious issues is significant swelling of the lymph nodes, liver, and spleen. The liver may become sufficiently inflamed, and it causes jaundice. Roseolovirus is not very toxic to its host. It does not denature any cells or inhibit them unless the fever gets too high, and ordinarily the host is not greatly harmed. And that is a picture of the Roseolovirus. Next slide. So the virus interferes with normal pathophysiology. Although we know how Roseolovirus presents itself in a patient, there is not yet any biological explanation of how it might differentiate, contributing to the pathogenesis. Scientists and researchers are still looking for answers about this virus. The Roseoloviruses have also been identified to certain autoimmune diseases like multiple sclerosis, but the specific role is often unknown. For the first few days, there is no way to know that the Roseolovirus is what is actually causing the fever. So one suggestion made by a research study in clinical infectious diseases was they were investigating the likelihood of the Roseolovirus being transmitted from mother to child, thinking that that might be the cause. So they thought infections might be associated with a very low virus load, such as their genome would not be detected in amniotic fluid samples with the use of current PCR procedures. But at the conclusion of their study, they discovered that the virus is not spread from mother to child. Everyone is at an equal risk to develop Roseolovirus. It doesn't target a specific gender or race. It does tend to target babies and young children more than adults. Most people who are infected with this virus don't have any symptoms. Those who do will experience them before age 2, and by this age, almost 100% of children in the United States have had it. Almost everyone who acquires this virus acquires it during childhood, and symptoms are most commonly presented in children between the ages of 6 to 12 months old. The socioeconomic status of a child or individual affected does not have anything to do with the likelihood that they contract it, but the socioeconomic status does have a slight influence on whether or not the virus could cause secondary issues. This is because there's a possibility that if the high fever is not treated in a patient, then it will go on and get worse. Next slide. The significance of the disease on the community is that even though scientists are unsure of this disease, it is very likely that contracting it has to do with coming into contact with another person who has had the virus. So parents should be cautious of transfer of infection. If a parent takes their child to a playground, for example, they should make sure that all the other children around are healthy. In reality, though, most children are going to develop this virus, and the fact is that it's not ordinarily life-threatening, and there's little to worry about in the community. When it comes to disease management, there are a few current treatment trends that are commonly used to control the disease. Some common treatment methods are to administer medications such as acetaminophen and ibuprofen, and they're usually to lower the fever. They're both very effective in lowering extreme temperatures and safeguarding children from seizures brought on by those fevers. Sedatives can also be administered if the seizures are becoming an issue. And when a patient spikes a high fever, it is best for them to have bed rest and drink plenty of fluids. Because this virus is usually very mild, no advanced management is required. Once an individual has had the virus, they are believed to be immune for future infections. The pharmacological impact is very slight. When examining the effects of acetaminophen, which is an ingredient in Tylenol, it's vital to pay specific attention to the dosage. This is because most of the patients taking this as part of their treatment plan are small children. So they need to take it in smaller doses and need to be more closely observed in case of an overdose. A doctor should determine the amount a child takes in based off of the child's weight. For example, an infant that is 12 to 17 pounds should be administered 80 milligrams of acetaminophen. This medication is not an anti-inflammatory, and nor does it inhibit the function of platelets. The only purpose of this is to bring down the affected patient's fever. Acetaminophen works because the apoptotic properties of acetaminophen are likely due to the direct effects of heat-regulating centers of the hypothalamus, resulting in peripheral vasodilation and sweating is what comes after that. There's not much one can do to prevent Roseolovirus. It is most likely going to occur no matter what you do. As mentioned previously, almost all children in the United States will come in contact with this virus, and it's practically inevitable. But there isn't much to worry about because most children also do not exhibit the symptoms. If, as a parent of a young child, one is very concerned about this, it is important to practice good hygiene and make sure everyone who encounters your child is healthy. And in conclusion, the Roseolovirus is a very common infection that is, for the most part, inevitable. After exploring the pathophysiology, disease management, pharmacological impacts, and prevention plan, it becomes clear that this virus is not much to worry about, and no one should concern themselves greatly. This is not to say that this virus should be understated. It is still very important to keep children's fevers down and try to prevent seizures from doing any damage to a small child's body. And those are my resources. The end.